Hello, everyone. Welcome to today's Q&A session, or as we were calling it, a masterclass. We've got Dr. Alan McCubbin presenting on, as it says, pre and post-exercise hydration, the what, the why, the how. Now, this is part one of a two-part series, which we're very excited to have Alan sort of divulge his expertise in hydration. Hopefully, it will answer a lot of questions that a lot of athletes have, and we will certainly try and have some time at the end for live Q&A. If you do have questions during the session, please pop them in the chat and we'll be sure to go over those. Okay, without any further ado, I'll hand it over to Alan.
Cool. Thank you, Scott, and thanks everyone for joining. As Scott said, this is part one of two parts around hydration. Today, we're going to focus on sort of the pre-exercise hydration, whether it's training or a race, and then post-exercise hydration, particularly around training. I guess there has been some controversial aspects of hydration over the years. Probably most of that has come around the during exercise stuff. So where there's a lot of confusion, I think, in some cases, and as I said, a little bit of controversy in the scientific area is probably more around that. So obviously we're going to get into that in more detail when we look at part two, which is going to focus purely on the during exercise part of it. And that'll feed in nicely with a session that Scott's going to do around using the sweat testing part of the Fuelin app as well, which will form part of the planning for that. Okay, so today we'll talk a little bit about why hydration is important generally. We'll talk about how much fluid we need. As I said, this is going to be specifically pre and post exercise today. We'll talk about, whether the type of fluid matters. So whether it's just plain water or whether there's other things in that fluid. We'll talk a little bit about putting it together for race day, and we'll definitely get into that more specifically when we get to planning your nutrition for during the event as well. So I think most people are probably aware of who we are. Obviously, Scott did the introduction, one of the founders of Fuelin and one of the coaches, Elizabeth, and I didn't see before, is Elizabeth on the call today? No, okay. And she's obviously one of the coaches as well, and I've joined the team just in the last probably almost 3 months now, to do some work with athletes as well, and also some of the work behind the scenes. So I guess if we get into hydration and why is it important, I guess we can think of this in general terms around hydration and health, and then we can talk about that specifically for athletes in the context of exercise. I guess from a broad perspective, optimal hydration is super important for health. We tend not to think of water as a nutrient, but really it is, just like our macronutrients, our carbohydrate, protein, fat, and our micronutrients, our vitamins and minerals, and of course fiber as well. Water is another essential part. We have recommended dietary intakes or daily allowances, depending on which country you live in, for water, just like we do for all of the other nutrients. And in fact, if you think about it, water is the one substance that we require in the greatest quantity out of any of the nutrients. So we think about protein, fat, carbohydrate, we're generally talking in grams, so maybe, 50 to 150 grams a day of fat, depending on the person, maybe 50 to 200 grams of protein a day, depending on the person, and maybe anywhere from, 50 to 500 or even more grams per day of carbohydrate, depending on the person and the day. Obviously, part of what Fuelin does is adjust that for training load. But water, we actually need in liters or kilograms per day. So it's another level up again in terms of the quantity that we need on a daily basis. So why is that? Well, firstly, water makes up about 50 to 60% of our body weight. That does vary a bit depending on percentage body fat. It's a bit different in males versus females, but it's generally within that range. The other thing is that we lose over 2 liters a day, generally speaking, through either urine losses. We lose some through our breath. So we lose water vapor when we breathe out. And then when exercise comes into the equation, obviously sweating as well. And in terms of, I guess, all the different nutrients that we could become deficient in that can impact on our health negatively, dehydration is going to be the one that impacts us the fastest out of any sort of nutrient deficiency per se. So, we're going to die of dehydration long before we die of starvation. And, people can go on hunger strikes and last a few months. Whereas if they stop drinking water, they're going to last a few days, not a few months. So from that perspective, obviously we turn over water a lot more than any other nutrient. And so it's really important from that perspective. water is involved in so many different things in the body, from cushioning our joints to allowing all the different biochemical reactions that take place in all the cells of our body to, helping transport things around in our blood. So there's so many different roles of water in the body, which is, one of the reasons why it's so important. From an exercise specific point of view, though, I guess there's a couple of things that we're particularly concerned about. One is regulation of body temperature during exercise. So obviously when we exercise, we're producing energy in our muscles to help us move. And as we produce that energy, we produce heat as a byproduct of that. And so our body temperature rises during exercise. So water is really important in terms of helping us to regulate that rise in temperature and maintain a stable body temperature. So firstly, water acts as a heat sink. So water actually takes quite a lot of energy to heat up. And the more water we have, the more energy we can absorb through that process without elevating the temperature. And I like to use the example, if you think about an electric kettle, and I know in America, people don't always have electric kettles. It's pretty common here in Australia. You can put a small amount of water into a kettle or a pot on the stove, and you can boil it, and it boils quite quickly. But if you fill it all the way to the top and boil it, it takes much longer to bring it to a boiling point and raise that temperature up to the boiling point. So in the same way, within our body, the less water that's in the body, the quicker our body temperature is going to rise, because that water can't absorb that energy to cushion us, I guess, against that rising body temperature. So that's important. But probably the main one during exercise is the evaporation. So as we sweat, we're basically making the surface of our skin wet, and that water on the skin surface will evaporate away out into the atmosphere. And when it does, it actually removes energy and therefore heat from the body. Now, technically, it actually doesn't matter where that water comes from. If you evaporate water off your skin surface, you're going to be drawing heat away from the body, regardless of whether that water came from inside your body, in other words, sweat, or if that water came from pouring water over yourself. And so that can actually be a really useful strategy during exercise, is actually to keep your skin wet through external water rather than just relying on your sweat glands, which are going to draw that water out of your body to achieve that. And your sweat glands are very good at regulating how much sweat they produce based on how much we actually need to get rid of body heat. And so if we keep our skin wet externally, we remove some of the heat that way, we actually don't have to produce quite as much sweat. Now, the other way that we help from a body temperature regulation point of view is our blood vessels are very good at rediverting the blood to different parts of the body, depending on what's required at the time. And so when our body temperature goes up, that includes trying to get rid of some of that heat. And that's really about increasing the amount of blood that flows to the skin as opposed to other organs in the body. And so that can be really useful, but it can be a downside as well, because we're then drawing that blood away from some of our abdominal organs, for example, and that can increase the risk of gut issues during exercise. And it's one of the risk factors for gut problems during exercise is dehydration and high body temperature, because in both cases, we're diverting blood and therefore oxygen away from the cells that line our gut. So that's the body temperature side of things. And then obviously there's the performance side of things. So there's a couple of aspects to this. We know that hydration is important in regulating our body's stress response to exercise. So whenever we exercise, we have some level of stress response. That's completely normal. I guess if you want to know what I mean by a stress response, just think about if you were riding your bike and a tiger ran out from behind a bush and started chasing you on the bike, then you would know what a stress response is. Now, that's obviously an extreme stress response. Hopefully you're able to outrun the tiger, and a few minutes later, things kind of settle down as you realize your life's not in danger anymore. And so it's a very large stress response, but it's only for a very short period of time. Whereas during endurance exercise, it's a much smaller stress response, but it's over a much longer period of time. So you're exposed to that for a longer period. And that stress response impacts on hormones, it impacts on our nervous system, which then feeds back to our gut, probably increases our risk of cramping, a whole bunch of other things as well. So this stress response is quite important during exercise. And we see this, or we can see this in training. If you go out and ride or run at a constant intensity, as you become dehydrated, what you'll notice is what we call cardiac drift. So your heart rate actually starts to creep up, even though your pace or your intensity hasn't changed. And that is part of that stress response to dehydration. So there's this stress response going on. Obviously, being well hydrated tends to keep our heart rate lower for the same intensity. As I said, reducing the risk of gut issues because the nervous system interacts with the gut. But ultimately, the mechanism of why does all of this impact on performance negatively, and we know it definitely does, is still kind of unknown. There's a bit of a body temperature element, there's a bit of a stress response element, but exactly how and why performance is impacted, performance itself is still a bit of a black box in terms of, is it going on at the muscle? Is it going on at the brain? Is it an interaction between the two? There's a lot of theories, but we don't know 100% for sure. All we can do is actually measure the response in the lab.
Alan, is cardiac drift, is that solely related? That's not solely related to your hydration status, though, as far as I'm aware. Is it like your training status also impacts cardiac drift? Is that correct?
Yes. Yeah. Because it's that nervous system response to the hydration or to other factors. But yeah, that's a big part of it. And also just the lack of blood volume.
So is that, in terms of the importance of hydration status to cardiac drift, is that related to, as you've got less blood volume, that's going to put more stress on the heart, and that's what causes that elevation in heart rate relative to the pace? Is that what it is?
Well, originally that was kind of the theory. It's just like there's less blood volume there, so you've got to pump it more to get it around. Over time, the scientific consensus has kind of suggested that maybe that's too simplistic. There's more to it than that. And it involves that kind of stress response to exercise. And we see that in studies of dehydration, they tend to have elevated cortisol, like those stress hormones are elevated, and that impacts on heart rate as well. It's still not 100% clear. It's very hard to unpack all the cause and effect relationships in this, and there's multiple factors going on. So it's hard to tease it out, but it's probably a little bit of both.
Okay. And then just one other question on that stress response. Obviously, cortisol is talked about a lot by a lot of athletes, and obviously there are athletes getting it tested, probably not as much as what is required to actually get a thorough understanding of cortisol. But if someone does have chronically elevated cortisol measured maybe just periodically once a month or anything, is it possible that hydration status could play a role in that? This
is more about the acute response during exercise.
Okay, so you're talking more about acute response. What about chronic response in terms of cortisol? Does hydration play a role in that? Is there any research around that?
Not that I'm aware of.
Okay.
Yeah, not to say it doesn't, but I'm not
for sure.
Any research that's shown that. Yeah.
Cool.
Cool. All right. So we know hydration is going to be important, but obviously there's different components to that. Obviously, there's being well hydrated prior to exercise. We'll talk about that shortly. There's the during exercise part and preventing the loss of fluid as we do inevitably sweat during exercise. As I said, that's the controversial part, or has been historically. We're going to bite that off in part 2. And then there's the post-exercise, sort of the rehydration component as well. So we're going to focus on before exercise and then after exercise today. So before exercise, I guess what I can say is, despite the controversy in the scientific side of things around how we should plan our fluid during exercise, how much loss is too much loss, that's the area that there is some debate around. It doesn't matter which side of that debate you look on. I think there is consensus absolutely across all of those camps that no matter which side of that you fall on, being well hydrated prior to exercise is recommended by everyone in every situation. So it is something I think that everyone can agree on. Now, there's a few different ways to kind of measure hydration. You can use fancy, urine-specific gravity and all sorts of different testing and things like that. There is actually no one gold standard of measuring hydration prior to exercise or just day-to-day hydration. There's actually a really good paper was written on this almost 15 years ago now, and the title is something along the lines of the elusive gold standard. And that's because it's hard to define exactly what is perfect hydration or optimal hydration. Is it in terms of the total amount of water in your body? And what's optimal for me might be different to Scott, is different to everyone else. And how do you define when you are at that optimal state? Is it the balance of fluid between the inside and the outside of your cells? Is it about the concentration of all the dissolvable bits within your blood? there's so many different ways you can define it, and there's no clear consensus that one is better than the other, or even exactly of what is perfect. So from that perspective, we're kind of looking for this perfect marker that probably doesn't exist. But I guess a lot of those are kind of academic anyway, because a lot of those require expensive lab equipment or blood tests and things like this, which are not practical in the real world. So what we want to know is, you wake up in the morning, you've got a training session that morning. Am I well hydrated for that session or a race or whatever it is? So the same guys, Larry Armstrong, I can't remember which university he's based in the US. He's just recently retired. He came up with this model to kind of be a bit more practical and bypass a lot of the lab equipment and things, to say, well, am I well hydrated? And he uses 3 different components. So using weight, so actually looking at your body weight, and if it's dropped significantly from what it would normally be when you're quote unquote well hydrated, is the first component. The second component is urine color. So I'm sure a lot of people are familiar with urine color charts. There's a few sort of famous and infamous ones out there. If you Google it, there's a one from, I think, the Texas Longhorns football team, where it says, I think it's, if you're below a 3, you're a selfish teammate, and if you're below 5, you're going to Area 51 or something like that. But this is the original color chart that was devised, and so you can see the different urine colors below there. And so most people are pretty familiar with this and using urine color as a marker of hydration status. It's not perfect, and we'll see in a minute, none of these are perfect, which is why we actually combine them together. And then the final one is that sensation of thirst. So whether you actually feel thirsty or not.
Alan, just a couple of things on the urine color. One thing I know when we used to do this with a lot of the rugby boys is what we discovered was that they never should take their first pee of the day, nearly, because often that would be quite concentrated. And then if we then took it off their second one, and we were doing osmolality as well, testing, but we found that the second pee of the day was probably a more reliable marker. Now, again, if they've got a morning session, that's not always possible, but I guess that's one thing to consider. I don't know if you've seen that. And then the other thing would be, if they are taking a B vitamin complex, to be very aware of that, because that obviously can make your urine bright yellow, and that's something that athletes should think about. And obviously, if they're taking beet supplements and things like that, that could change the color of the urine as well. So I think to that point, I guess, like you're saying, urine color is useful, but it may not always be the only thing to hang your hat on. And actually looking at weight, again, being very important, not necessarily from a weight perspective, is it? But it's actually looking at what your normal is and what that float is overnight. And then, as you say, your thirst sensation. So it's really interesting, all that.
Yeah. So in terms of that first morning pee, I think whether that's appropriate or not just depends on what criteria you assign to what's considered normal or not. So you do have to consider that, you're right, it will be darker in the morning, and that's because your kidneys deliberately, slow down overnight. Otherwise, you'd have to be up peeing all night. And so, it's pretty normal that your first urine in the morning will be darker. So all we need to do then is just adjust the criteria of what's considered normal or not. I think the misconception that a lot of people have with urine and hydration is that urine is a marker of hydration. It's not. It's a marker of what the kidneys have been doing to maintain normal hydration. Normal hydration is what goes on in the bloodstream in our body, not in our urine, and the kidneys will adjust as they need to maintain that. So the darker the urine, basically the harder the kidneys are working to conserve water. Does it mean you're dehydrated? Maybe. How much? Hard to say. And there can be times, particularly post-exercise, for example, where you've been sweating a lot, your kidneys will actually down-regulate, where, you can get false indicators from urine color and urine volume as well. So urine's not always a reliable indicator. Probably first thing in the morning is the most consistent. But as I said, you just need to adjust your expectations of what's normal and what's not.
And is that therefore, Alan, take into consideration something like, or add to that, weight? So look at what your weight is in comparison, and then marry that up to your urine color, and then you start. Okay, yeah.
Exactly right. Yeah. So this gets to this model that Larry Armstrong put together called the WUT model. So he takes those three criteria that I just mentioned: the weight, the urine, and the thirst. So the urine is, so I should have mentioned a urine color of 4 or greater. Thirst sensation is just, am I thirsty? And the weight is a weight loss of more than 1% below what you kind of your normal well-hydrated daily weight is at any given time. So the idea behind this model and the Venn diagram is that any one of those on its own is probably not a strong indicator of being poorly hydrated. So if your weight's down a bit, well, it could just be you did a big session and you've used up a lot of glycogen store in your muscle, for example. If you're thirsty, maybe you just got a bit of dry mouth, whether that's medication, whether you sleep with your mouth open, that kind of thing. And urine color, as I said, on its own is not the most reliable indicator, particularly if it's at times of the day other than first thing in the morning. But if you have two of those factors, so your weight is down a bit and you've got darker colored urine, then that's probably starting to build a bit of a case that maybe you are a little bit dehydrated. And if you have both of those and you're thirsty, so if all three of these things are happening together, then that's probably pretty clear cut that you probably do need to have more fluid in the system and you're not sort of at optimal quote unquote hydration. So the idea here is 1, probably doesn't tell you that much. 2, together, you're building a case, and 3, it's probably definitely there. All right. So what do you do about it? So you do that test and you go, oh, yeah, I probably could drink a bit more before I start exercise. Well, how much do you actually need to drink to bring your sort of your sense of hydration back up? Because that doesn't really give you a number, that sort of test. So this comes out of the American College of Sports Medicine guidelines from 2016, and they suggest consuming about 5 to 10 mils of fluid per kilo of body weight, or 2 to 4 mils per pound of body weight, about 2 to 4 hours before exercise. So the idea behind this is you do it 2 to 4 hours before exercise where you can. Obviously, if you're training first thing in the morning, that's not possible. I'll talk about that in just a sec. But it gives you enough time to, if that was more fluid than you needed, to pee out the excess before you start exercising, basically. So I guess if you go back to this diagram and if you go, yeah, I've hit 2 or 3 of these things, I probably need to drink a bit, then maybe you do go a bit more aggressive towards the upper end of these ranges. Whereas if you're feeling pretty good in the morning, you're not too concerned, then you're probably, towards the lower end of these ranges or even a little bit below that. The other thing I'd say here about, early morning training, and we know obviously that's a practical challenge to consuming this much fluid and having time to pee it out, is the closer to exercise or the less time you've got, probably you go towards the lower end of these ranges. And the longer you've got until you have to exercise, probably you can be a bit more aggressive, go to the upper end of these ranges because you've got plenty of time to pee out any excess. So that's, I guess, trying to maintain sort of quote unquote optimal hydration prior to exercise. There is another strategy that people sometimes use, and that's called hyperhydration. And that's actually trying to start exercise above your normal level of hydration. Now, this is not a strategy that's used very often. It's usually used in elite and professional athletes. It's usually used in specific events where it's very hot, sweat rates are going to be extremely high, and it's either going to be practically difficult or just gut tolerance not possible to drink enough fluid to prevent significant dehydration during that race. So examples I can think of where this has been used would be, say, the Tokyo Olympics in the marathon. The race walkers used that there as well. The World Athletic Championships were in Doha a few years ago. That was used there. These are the kind of events where, practically being able to drink large volumes of fluid in a marathon at the elite level is almost impossible. So that's where you'd see this is probably not a strategy you would generally use in something like Ironman. Usually, tolerance of fluid is okay in those kind of events. I'd say that this is not going to last you the length of an Ironman anyway. And if you're struggling to tolerate fluid in an Ironman, your access is usually not a problem in those events. And you can probably actually train your gut tolerance over time to improve your ability to consume fluid. So probably not a strategy for Ironman, maybe useful for sprint and Olympic distance. Or as I said, things like a road marathon at the elite level, particularly in very hot environment. So in this case, instead of 5 to 10 mils per kilo, we're looking at 10 to 25 mils per kilo. So this is a lot more fluid, or 4 to 10 mils per pound. Again, about 2 to 4 hours prior to exercise. Now, if you were just to do that with plain water, you'd just be going to the toilet. You would go in, it'd go in one end and you just pee it straight out the other, because the body's saying, well, you're putting in more fluid than I actually need to maintain normal hydration. So I'm going to get rid of the excess. So if you want to do this and actually retain all of that additional fluid, you need to add something to that fluid to be able to do that. And that's generally going to be what we call an osmotically active agent, something like glycerol or something like a large dose of sodium. Now, this particular type of strategy, as I said, it's not used very commonly and it can go wrong. So I'd highly recommend, if you're going to do something like this, that you get professional advice on how to do that rather than just trying to do it yourself at home.
Yeah, Alan, on that, with that, can you hear me? Yeah. Obviously, I think your last point is a very good point, because obviously I have personally used that with athletes, but it's been done very much in a controlled manner where that athlete has a very high sweat rate. We've discovered that through multiple sweat rate testing where they've been weighing themselves before and after sessions, have an incredibly high sweat rate. They know they're going into a hot race, whether it be a 70.3 or a full Ironman distance, and they have used, I noticed that's only 2 to 4 hours. And obviously we've done that in the morning of using, say, and I'd like, if you could clarify what you think is a high sodium amount to take in. They usually take in somewhere between 1,000 and 1,500 milligrams of sodium with that bolus of fluid. But we've also done that sort of 24 hours before. Do you have, I know you recently, I think you're about to publish a study on this, but where does that sit with like the 24 hours beforehand sort of hyperhydrating as well? What have you seen?
Yeah, so my last study of my PhD actually, it wasn't for the purpose of hyperhydration, but we did sodium load them for 3 days prior to exercise, and we didn't really see any advantage in that over this kind of 4-hour load. So I think either will achieve the same result. It's probably more about what's more practical for the person.
So you could do 24 hours before or the 4 hours before. Is that, I mean, that would be based on the practicalities, and you see.
Yeah, I think what happens though is if you try and do it too long before exercise, your kidneys are too clever. Like we try and trick the system by adding the sodium or the glycerol or whatever. But, after a few hours, your kidneys just take care of business and they're not going to put up with that. So they kind of undo all that hard work that you've done.
So you could just do the morning of, so with your breakfast, your race breakfast, ideally around that 3 or 4 hours before, you could then take in, say, that 10 mils of fluid per kilogram with the acute sodium bolus and remove the need to do it the day before and just sip on water and make sure you're hydrated. Okay, that's a good tip, because generally speaking, I've always done both, but maybe it's not required, and maybe it's just an extra step that is just a practical pain in the ass.
Yeah. I mean, your kidneys are so good at regulating
exactly.
sodium, for example, that they're going to remove all that extra sodium you put in, and then the body's going to say, well, I don't need all this extra water now, and remove that as well.
Yeah. And in terms of that acute sodium load, we won't get into glycerol, it's probably a whole different talk, but in terms of sodium, is there a range in sodium? Does that depend on the individual, or do you sort of say, look, this is a decent amount of sodium, irrespective of the athlete's size or gender or anything like that?
Yeah, so it's about the concentration in the fluid that you're drinking. So it's not like you have a certain amount of sodium and then you drink fluid. It's like you have a certain amount of sodium per liter of fluid. And I guess it's trying to get that as close to your blood sodium concentration as you can, while still being tolerable that you'll actually be able to drink it, because that's very salty. So it is tricky. So if we say, blood sodium concentration at the lower end is going to be about 130 millimoles per liter. So multiply that by 20. So yes, you're looking at close to sort of 3,000 milligrams of sodium per liter of fluid.
Okay, so if you're looking at,
ideally,
so it's probably around, for an 80 kilo athlete, you're talking that's what, 12, 13 mils, something like that, 13 mils per kilogram, and putting potentially around 3,000 milligrams into that liter. And that's for a heavier athlete. So I think that's we'll probably get some questions around that for follow-up,
Yeah.
but because I do see typically around most athletes taking around that 1,500 milligrams, and that just seems to be set in stone as opposed to a reasoning for that. So it maybe I have to make that a little bit more, objective and specific to the individual based on their weight and the amount of fluid they're taking in. Yeah, it's good.
Yeah, and I think the important point here is that there's only a very limited sort of number of use cases for this kind of hyperhydration prior to exercise. The vast majority of people, the vast majority of the time, don't need to do this. The 5 to 10 mils per kilo is absolutely fine. There's only those limited circumstances, and as I said, they're usually elite and professional athletes, and they're usually working one-on-one with someone anyway in those scenarios. Yeah,
no, for sure.
Cool. All right, so that's the before exercise side of things. As I said, we're going to skip the during exercise today because we're going to come back and cover that in part 2. So let's skip to what happens post-exercise now. So we've gone out and exercised, we've sweated, we've drunk some fluid, presumably, maybe not if it's a relatively short session. And so we've got a bit of a fluid deficit. We've obviously lost some fluid that we probably haven't replaced in most circumstances. So what do we need to do post-exercise? Well, I guess the first thing I'd say here is it is a little bit dependent on what the goals are from a recovery point of view. So if I often have people go, oh, how much should I drink after my Ironman? And I'm like, well, are you training for the next few days after your Ironman? No, well, do whatever you want. I don't care. There's no particular goal to be rehydrated for in an awful hurry. And, if you've got 48 hours plus until your next big training session, your kidneys are going to take care of that anyway. And your sense of thirst is going to get you to where you need to be. So what I'm saying here is more about if you need to rehydrate in a relatively short time frame and be back to sort of optimal hydration or as close to that as you can be for a next training session, or if you're doing some sort of stage race and maybe running or cycling or something like that. So in those scenarios where you need to be rapidly rehydrated or twice a day training maybe, we know, first of all, that when you stop exercising, your body temperature is going to take a little while to come down. And so you're probably, even after you stop and maybe you've done your sweat testing and weighed yourself at the end of exercise to calculate a sweat rate or your overall losses, that you're probably still going to be sweating out a little bit more after that. The other thing is obviously when you drink some of this fluid post-exercise, some of it will get peed out again as well. And so for both of those reasons, we need to actually replace more fluid than what we actually lost during exercise. So the recommendation in the guidelines is about 125 to 150% of the deficit at the end of exercise. So it's not the total amount that you lost, it's the deficit. So what you lost minus what you drank during the session. So if you finish the session, 500 mils or, 500 grams down, then you're drinking 125 to 150% of the 500 mils or the 500 grams. It's not, you might have sweated out 1.5 liters, but you drank 1 liter. So you don't need to calculate it on the 1.5 liters. It's just the deficit at the end. And then that should be done in about the first 4 hours or so after exercise to rehydrate fairly rapidly.
And probably just clarify for American athletes on the call, 1 liter of fluid lost or water lost is going to equate to roughly 1 kilo, which is going to be 2.2 pounds of fluid or weight that you've lost. So 2.2 pounds times 150%. What are we at? We're at 3.8, 4, let's say 4 pounds, something like that you've probably got to look to replace in that. What did you say? Up to that 4-hour period afterwards. And should that just be water, Alan, or would you be thinking
that's the next slide,
fluid? Oh, is it? Sorry.
Yeah.
No worries. But yeah, just for those American athletes. So I think 1 liter is 1 kilo. 1 kilo is 2.2 pounds. And then you're just applying that equation to that. So,
Yeah. And presumably, Scott, and you'll cover this obviously in the session around the sweat testing function within the app. That's going to be able to calculate it in fluid ounces and pounds rather than kilos or liters anyway.
Whatever their dietary preference is, we'll tell them what they should be aiming to drink during that session. And then certainly post-session based on, using this exact calculation is what athletes should be aiming to replace their fluid loss with. And certainly I think it's an area where athletes historically haven't paid enough attention, I think. And actually, when they really go, you know what, I lost a pound or I lost 2 pounds of fluid in that after that session, and getting that fluid back in that next 4-hour period, it has a very positive impact on the next day in terms of training ability, in my experience, but also just in terms of how you feel for the rest of the day and also your sleep. I've certainly had anecdotal responses from athletes when they focus on their rehydration. Certainly for those athletes who lose a lot, they just tend to recover better throughout that day, and then certainly overnight and into the next day. So I think it's a really good, a poignant point to emphasize, look at what you're losing after training. And that's where you can, using the sweat rate feature in the Fuelin app, it really does highlight sometimes how much you are losing in sessions you don't think you're losing.
Absolutely. And particularly with summer now in the Northern Hemisphere, that's going to be far more common.
Yeah, it's heating up.
Yep. All right. This is your question, Scott. Does the type of
Perfect.
fluid matter? So a lot of this really depends on your goals. Part of this is around actually retaining that fluid and not just peeing it out. As we talked about before exercise, the same can occur post-exercise as well. But the other thing we have to think about in the post-exercise period and to some extent pre-exercise is it's also part of your fueling strategy can come with these fluids as well. And so we might be using this fluid not only for its water content, but because it's providing us with protein from a recovery point of view, or carbohydrate from a refueling point of view as well. So that's all the things that we kind of have to keep in mind here. So I've got here both pre and post exercise scenarios, and whether we're trying to include carbohydrate, protein, sodium, or glycerol here. So pre-exercise, if we're just trying to be, reasonably well hydrated, what we would call euhydration, the carbohydrate is really about what you need from a fueling point of view for the session. It's not required from a fluid retention point of view or anything like that. Usually protein in that immediate pre-exercise period is not necessary, although it may be part of just your daily protein strategy, which is fine as well. Sodium, glycerol certainly unnecessary if you're just trying to maintain normal hydration. That's only really for that hyper or over hydration prior to exercise. Should you include sodium or electrolytes? That should be electrolytes, not glycerol here. Well, actually, if you're consuming food along with that, the electrolyte content makes no difference to the fluid retention, because you're going to get some sodium, but also some carbohydrates and amino acids and other bits and pieces that go in your food that actually will take the place of the electrolytes in terms of helping with the fluid retention. There's been some great research on that from a group here in Queensland over the last 5 years or so. So prior to that, everyone used to talk about, milk. They used to talk about sort of your clinical rehydration solutions, like your very high electrolyte beverages, as being absolutely critical for retaining the fluid that you drink. But the problem is that was all based on research where they gave them just that fluid and then followed them over a few hours where they didn't include any food. But of course, in the real world, normally, particularly post-exercise, you'd be eating within that few hours after exercise anyway. And so as soon as you add food into the mix, the type of beverage makes no difference to how well it's retained or not. You can just have plain water in it. It doesn't make any difference.
And Alan, just on that, just on that, I think that's such a good point to make, actually, and it's something I've found personally where, obviously we are encouraging athletes more often than not to eat something before their training, certainly when the intensity and the duration is applicable. But I have found that personally, if I was consuming, say, a decent amount of electrolytes in conjunction with the food, it often just made me extremely thirsty during the session and forced me to drink a lot of water. Whereas I have actually myself reduced the amount of electrolytes being consumed before training, especially when I am eating food, because I was just like, well, exactly to that point, I'm probably taking in some sodium with that food anyway. So, And
I think one of the other messages there is, particularly for more recreational athletes where maybe weight loss is a goal, or they're just exercising for health rather than for you're trying to be absolutely as competitive as they possibly can, then in that case, why not just have plain water?
Yeah.
Yeah.
I think also from a practical standpoint, it might save some athletes a little bit of money You can save your electrolyte pre-session, and as it says there, if you need to hyperhydrate, obviously use it, but maybe you can save it for later in the day if you are drinking a little bit more fluid, that because you've lost the weight and you need to get some in, you want to retain a bit of the fluid, maybe save that electrolyte for later in the day as opposed to using it up first thing in the morning.
Yeah, definitely. Okay.
Yeah.
If you're aiming for that hyperhydration, as we said, carbohydrate can be there from just a fueling for the session point of view. If it's a hard enough session to need hyperhydration, it's probably going to require carbohydrate as well. Protein unnecessary during that time period, but you will need some electrolytes or glycerol or a combination of those two to help retain that fluid, or the excess is just going to be peed out again, and you've sort of wasted your time and effort of drinking all that extra fluid. Post-exercise, from a rehydration point of view, as I said before, it's really about, well, do you need to refuel? If so, carbohydrate will be useful here. Do you need protein from a recovery point of view? Probably most of the time. Does that have to be in the fluid? Not necessarily. That could come from your food. And again, electrolytes unnecessary here if it's combined with food. If for some reason, for practical reasons, or, some people do a long run and they just really have no appetite for several hours after exercise, then yes, this stuff does start to become important in those scenarios, but that's probably the minority of people.
So Alan, if they had lost, let's say 2.2 pounds, a kilo of fluid, and they did have access to food, you're saying that potentially they don't need to consume specifically an electrolyte to regain that fluid balance. If that food they chose was low in sodium, though, was like purposely low sodium, maybe they're on a diet with low sodium or something, would you then encourage them to utilize
it
specific
doesn't seem to
electrolyte?
be. No, because the other nutrients have similar effects. The other nutrients in that food. Yeah.
Interesting.
Yeah. The other thought behind it is also that the food just slows down the emptying of that fluid from the stomach. And again, that controls kind of the rate that it enters the blood, and that probably helps from a retention point of view as well. All right. So let's pull that together as a bit of a summary. So I guess the first question is, am I hydrated on a day-to-day basis, thinking about training or potentially race day as well? Using that weight, urine, thirst model is probably the most practical way of doing that, to not be overly reliant on any one of those in isolation, because we know that that can be a bit unreliable. But once you combine them, you can get a pretty good picture of what's going on. From a pre-exercise hydration point of view, if you want to be absolutely certain, or if you are a bit low, having done that WUT test, then 5 to 10 mils per kilo or 2 to 4 mils per pound a few hours before exercise, with or without carbohydrate, depending on if that's required in that scenario, will in most cases get you where you need to go from a hydration point of view. Obviously, there's a practical limitation on that. If you're waking up and you've got to hit the road within half an hour or something like that, then probably go towards the lower end of that, or you may find that you have to pee, shortly into your exercise session, particularly if you weren't that dehydrated to begin with. Hyperhydration, as I said, obviously it's a similar concept. It's just a much bigger volume of fluid, sort of 2.5 times the amount. And so because of that, you need something to help retain that fluid, or your kidneys will just flush it out. And as I said, I think, really getting some one-on-one advice when you start to play around with those doses of electrolytes and glycerol and things like that is really important. Post-exercise hydration, I guess it's more around, well, do I need to be rehydrated quickly post-exercise? If the answer is yes, then 125 to 150% of the deficit that occurs during exercise, not the total loss, just the deficit, and then carbs and protein based on your recovery goals. And really in both of those situations, before and after exercise, really, going aggressive with the electrolytes is really unnecessary if you're combining that fluid with food, with the exception of the hyperhydration piece, where you really need that extra electrolyte to retain that fluid. Cool.
And Alan, with that bit just then you put in as well, about obviously electrolytes and food, and you had the image of milk. My understanding is milk is actually a very good rehydration strategy. Is that that includes obviously fluids, so whole food fluids like milk, or what about plant milks then? Are they as good as cow's milk in terms of a rehydration strategy?
So if we look at what it is in cow's milk that helps from a fluid retention point of view, it's probably, there is actually a bit of sodium in milk, not massive amounts, but there is some. But it's also probably the protein and fat content in the milk, and to a smaller extent, there's obviously lactose, the carbohydrate in there as well. And so, most of those things you will get in plant alternatives to milk as well. You're still going to get, in most cases, the protein, maybe not for something like almond milk or oat milk, but certainly soy milk, you'll get that protein there as well. You'll get, obviously, the fat. It might be full fat or reduced fat. Again, that won't be any different to what it is in normal milk. So yeah, the differences shouldn't be massive, I wouldn't have thought. I don't think they've been directly compared in a hydration perspective that I'm aware of, but I can't see any reason logically why they wouldn't be similar.
Yeah, perfect. We do have some time for some questions. Does anyone have any questions specific to what Alan has talked about first, before we get into some random questions? Does anyone have any specific questions based on either, what Alan said, or maybe personally, from a personal perspective, what you're finding with your hydration status? Are you doing what he said around sort of understanding your hydration status before exercise? Karen, you should answer this. Phil, how are you finding? I know you're pretty, you have a lot of questions usually about this sort of stuff. How do you find in terms of your hydration status before training? I think you're on mute, Phil.
No, he's put it in the chat.
Oh, he's put it in the chat? Oh.
The day before a race, 8 ounces an hour. I'll have to get out the old conversion from ounces to
what ounces
mils.
Is? Yeah, I think ounces. I think that's about 200 mils. I think it's only about 200 mils, something like that, 8 ounces. So
yeah.
Karen, how have you?
240.
Oh, Phil, you're Are you still on? Can't hear you. Karen, how are you finding sort of your hydration status? Like in terms of your awareness of sort of requirements for a day-to-day versus sort of performance on the bike and in the run. Has it changed a lot? Yeah, you, Karen, would.
I've been more aware of it, especially like throughout the day. I'd never done electrolytes before, and thought about, adding that in. And I was one of those runners that never ran with any kind of fluids whatsoever. So I've been much better about getting fluids in during run, and it's been a lot better. I mean, it's helped a lot.
Have you?
We'll talk about that in part 2, like the during exercise component as well. Yeah.
Are you aware, like, I mean, when you find, if you have sweat a lot and you've done sort of this sweat rate test and you've seen that you've dropped a lot of weight during, how much more conscious are you of sort of rehydrating during the day?
Probably not as much as I should be, but I'm not great about doing sweat tests either.
Yeah, well, that's true. That's true.
Yeah,
I'm
we'll
not
talk
the
about
poster
that
child
in
for
part.
this.
And I think for those athletes on there, like, there is those reminders in the Fuelin app about hydration, where it's just that nudge to sort of, when you see that hydration, like, don't obviously glance at it. You can pass over it if you want, but it's designed to give you that nudge. If you do need to drink purely water because you did a session in the morning and you worked out, oh, gee, I have dropped, a pound or 2 pounds of fluid, those nudges to get you to drink, water plus or minus your electrolytes is there on purpose, especially for those athletes who are doing second sessions in the day and or training the next day to allow you to recover fully. So, everything in the program is there, with a purpose. So, whilst you see it probably every day, and then gradually when you see things every day, you tend to just become blasé to them. So they are there to remind you to drink. Okay. It's not to overconsume fluids, but it's just to get on point with what your specific requirements are.
Just going back to Phil's question, because he's written in the chat, are we looking at drinking that 8 ounces an hour the day before a race? I think that the key thing there, Phil, would be that usually the day before a race, depending on the event, most of the time you'll probably be carbohydrate loading during that period anyway. And fluids is one of the easiest ways to actually get in more carbohydrate the day before. So I think in most cases, probably people get enough fluid the day before a race because it forms part of their carb loading strategy anyway. But certainly that volume of fluid, if we think about that, maybe over a 10-hour period, a bit over 2 liters of fluid over the course of the day, that sounds reasonable to me. I wouldn't necessarily say you have to go out of your way to, mark off if I drank, this amount per hour or anything like that. I think most people would, unless they tend to chronically underdrink, would probably get to something around that mark most days anyway. And as I said, with carb loading, you're probably a bit more conscious of that in terms of using that as a way of getting carbs in as well.
Barbara had a question for you, which may or may not be answered. She wants to ask specifically about glycerol strategy and how do you combine glycerol with water? Is there any time?
Yeah. So with the glycerol, generally you do add that into the fluid that you're drinking. And so you can buy glycerol from pharmacies, certainly here in Australia. It's actually used as a laxative. So that's what you do have to be a little bit careful about it. But when you combine it with a large dose of water, it's usually well tolerated. The issue is when you're having it without much water, it actually draws water into your gut, and that gives you the laxative effect, and it's designed for treating constipation in that case. But yeah, if you're combining it with that fluid, you usually won't get that problem. In terms of the timing, most people do it about 4 hours pre-exercise, and it seems to retain fluid for at least that amount of time. As I said, eventually if you do that too far in advance, your kidneys are going to start to just tinker with things and undo all your hard work.
I'm trying to remember the exact dose, the mils. There's quite a formula for it though, isn't there, Alan?
Yeah, and a lot of the research is based on kilograms of fat-free mass rather than just total body weight.
Say.
Yeah.
So it does help, in that case to have like an understanding of fat-free mass, that probably like a DEXA scan or something like that, doesn't it, in order to get it. I'm just trying to remember what I usually do.
Yeah. And the thing that can go wrong, I think, with glycerol, or a couple of things that can go wrong, and certainly talking to the marathon guys that ran in Tokyo about this, because they played around a lot with it in the lead up to the event, sort of 6 months out from the games. And, a lot of them chose not to do it in the end. A couple of them still did, but a lot of them chose not to, is if you go too high on the glycerol, it's similar to what you said, Scott, before. If you have too much electrolytes prior to exercise, you're just desperately thirsty. And that's not what you want to feel on the start line of a race in hot weather, where it's going to be hard to get enough fluid down and you desperately feel like you need more. So that's obviously a downside. And on the other side, if you, or the other problem that can happen if you have large dose, as I said, if it's too much relative to the water, is you draw water into your gut and start to get, diarrhea and things like that, because that's what it's kind of designed for as a pharmaceutical agent.
Yeah, and we had similar, because we used this in Bermuda with the sailors, with a few of the guys, because they were out on the water for so long and it was so hot and they had huge sweat rates. But I know, firstly, like all the nutrition practices, practice it prior to your race. Obviously, that's probably the most important thing, guys. We were using, I was just looking at my notes, we used 1.2 grams per kilo body weight. We used whole body weight in, again, it was 26 mils per kilo of body weight. So to give you an example, and I had an example here, it was 70 kilo athlete. We had about 84 grams of glycerol in 1.8 liters of water. And that's how we were using it. And they would consume that sort of like somewhere between 60 and 120 minutes before the event, just to get that in. And again, we did have some athletes who got severe GI issues and they swore never to use it because they were like, I don't care, I'll just try and drink some fluid during the race. But for others, there were a couple who loved it and they thought it really benefited them. And I can talk for a couple of, there's a couple of ultra endurance athletes on Fuelin who do use glycerol and they absolutely believe in it, and they use that in their ultra events, but they also use it in their Ironman events. And that's become their daily ritual, actually doing it 24 hours before and the morning of, but maybe the 24 hours isn't required and we might play around with that. But I think the biggest thing, Barbara, is I'd probably get some professional advice before just going and doing it, because it can have some negative consequences. But secondly, you certainly want to practice it well in advance of any race that you're going to do, and make sure that if you get disaster pants on a Saturday, 3 weeks or 4 weeks before a race, then it's not such an issue. It's obviously, not the best thing to have, like GI complaints, but better to happen a few weeks before the race than during the race, and work out what works for you. Cool. Has anyone else got any other questions? I know there's probably a little bit of math and stuff like that, which is always, oh yeah, Phil, you got a question? Still can't hear you, Phil. Not sure what. Yeah, anyone else got any questions?
Oh, coffee. Yep. So this is around caffeine and fluid retention.
While he's typing that, oh, there you go. Can you say that?
Oh, so is that included in that fluid volume that you have pre-exercise? Yeah, it can be. One of the things I think, a lot of people sort of hear that, the term that, caffeine is quote unquote a diuretic, and if you drink coffee, it'll make you pee out a lot more. What we see in the research, that there has been a few studies that have looked at this now, is that when you drink coffee with a caffeine content in it, the water that you get from the caffeine offsets any loss of fluid so any water from the coffee offsets any loss from the caffeine. Now, different if you're taking caffeine tablets or gels or something like that, where you're getting no or just a small amount of fluid with your caffeine. But certainly for coffee, I would include that. I don't think that's a major issue. And usually the caffeine content of coffee won't be high enough to produce that sort of big diuretic effect. So I don't think there's an issue there.
And then Manny asked, for novice athletes, do you recommend glycerol?
No, unnecessary. Yeah, as I said, it's really very hot weather races, usually elite athletes. Usually where I see it is the shorter events where you have, because the pace is higher, you have a much higher sweat rate, and you also have much more limited opportunities to access water and be able to actually drink and swallow it while you're racing, where the penalty for slowing down through aid stations and stuff is severe. So you think your elite marathon runners, they're never going to slow down and walk through an aid station to get enough fluid in to stay hydrated, because they've lost the race if they do that. And at that pace, they just can't drink, swallow, and tolerate in their gut the volume of fluid to offset the very high sweat rates that they have. So that's where you see it. But generally, I would say for novice athletes, definitely not. A novice athlete generally will have a lower pace and therefore a lower sweat rate than an elite athlete in the first place. So actually you're losing less fluid, so it's less critical anyway. The time penalty for slowing down through aid stations and things to maintain good hydration is less. And in novice athletes, actually we see the risk of overhydration is probably greater or more likely than it is in elite athletes, where you're under hydration. Generally, the faster the athlete, the more likely they are to be dehydrated. The slower the athlete, the more likely they are to become overhydrated during something like an Ironman.
I guess, Manny, it depends if you're a novice fast athlete. If you're asking that, but I think exactly what there's individual circumstances obviously with everyone, but majority, no, it's just not worth it. So not me. So to Alan's point, Manny, there's lots of other, this is the classic supplement thing, isn't it, Alan? It's like, does this super supplement make me focus on your low hanging fruit, like just looking at your fluid balance in general, and are you consuming enough fluids during your session, which we'll obviously cover next week, beforehand, afterwards. All the basics are going to be much more important than using something like glycerol. Glycerol sprinkles on top, guys.
Yeah, absolutely.
For specific athletes. Very good. Cool. Well, I know we're just on time, so there is part 2, and I know a lot of athletes will be. This sort of sets up, or at least gives the framework for why hydration is very important, pre and post. And obviously a lot of athletes are very enthusiastic about hydrating during exercise. And so Alan will cover that in the next session. And I'm sure come with lots of questions, because I'm sure there will be lots of questions around that. At the end of this, when it closes off, if you could just leave some feedback based on the session, things that you would like to know more about, or if there's anything that was covered today that you want some additional information about, we're certainly happy to share that with you. Alan, thank you for your time. Thank you for sharing your wealth of knowledge. Thank you for everyone who attended today, and we look forward to seeing your feedback, and we look forward to seeing you all next week. Cool. Alan, do you want to stay on after this?
Yeah.
Perfect. Thanks, everyone.